Oh, you hadn't seen that?
No, the internet was like also a perfect movie.
Yes.
I did not care for it.
What?
I did not care for it. It was very boring.
I need to hear why. But I'm not going to be satisfied.
No. There's not a good answer.
No,
Boy,
there's not
was
a good
I
answer.
bored.
From fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists.
These two Utes.
You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. And now broadcasting from the unnamed studio. That's Jim. It's Nick. It's time for some Pod Therapy.
Yeah, it was okay. I mean, I was waiting for it to get going.
Everybody.
Because all the clips that I've seen of it, it's Joe Pesci being awesome, right?
Now, is this just a...
it's a long slog of watching a man fail, and then all of a sudden at the end, he pulls it out, and you're like, cool. But like up to that point, boy, was I not entertained.
But
like,
is this just
what do you need to be entertained?
Comedy. It's
that's
not
what I'm wondering.
funny.
Is this an example of watching a movie out of time?
I think so.
This is because it
I'll
is
bet
slow.
for the time,
it is slow compared to a 2026 movie.
I'll bet for its time it was snappy. I can see that going because there's a lot of bits. It's just none of them are ha-ha bits. And it's like, oh, old Southern judge doesn't like this New Yorker. And I'm like, yeah, of course he doesn't.
But I don't think of that
very
movie
bad at
as
being a lawyer.
I don't think of it as a comedy movie.
It's listed as comedy. How do you see it? What is it?
I
Not
don't-
a drama.
I don't know. It's not
Doesn't
a
take
drama,
itself seriously
but
at
I don't
all.
think of it. It's not slapstick.
But you
comedy.
were talking about the Jamie Lee Curtis. Now you're at me doing
Pamela
Sigourney
Anderson,
Weaver,
you dummy.
Sigourney Weaver in Alien being
Yes.
like setting kind of a new trend.
An archetype.
Yeah,
The heroine.
I mean, like there had been heroines before.
Yeah.
That, but like for that time period, like
Yeah.
for that,
especially in a horror movie.
yeah, and like for that little moment in time, it was a reintroduction to that. I would say for sure.
Yeah.
and like comedy movies have changed a lot.
Fair. Yeah.
So like Anchorman, I think, is one of the big turning points. That's definitely after My Cousin Vinny. So all of the comedies leading up kind of to like those.
Yeah.
Because you had the Stooges, which was, like
physical comedy.
and like a couple of jokes a minute.
Yeah,
like
yeah.
or even like, a joke
Quick,
a second.
punchy,
that's
yuck
it.
yucks. They're never stopping.
And then like in the 70s and 80s, a lot of the comedy slowed
It
down.
was plot line.
It was plot line. It was plot driven. It was situational.
Yeah.
It was a lot of that.
Yeah.
I mean, even
Fish out of water.
That's a good point.
And also, like, there would usually be at least a serious plot line.
Yes. Which is what they tried to do in My Cousin Vinny.
Well, they
where you
do.
get
I mean, the plot line is
Murder
these two
charges.
kids might go to jail.
Yeah, or no, kill.
Or,
like they're
they might
planning on
put to
killing.
death.
Like Anchorman, you're right. It's absurdism. It's just it
Well, and
doesn't
they
take
just
itself
did like
seriously.
take after take after take after take because
Right.
you also get into. I think Anchorman is one of the last ones on film.
Yeah.
But the transition film to digital,
Okay.
it makes takes much cheaper.
So that's
because
when
you're not using the film.
nailing it. And also those ones are like, character comedy where it's funny because this guy is hilarious.
And like they might be improving on stage,
Sure.
so or on screen, on camera, so they might have like 20 different takes to then choose
Right.
from. Whereas a scripted film,
Here's
like
what-
you're doing the scene.
My Cousin Vinny was lacking that no character in the movie was funny. The situations were humorous, but only in the sense that like, oh, bad things keep happening to this guy. And at some point I'm like, I don't care anymore.
Yeah,
But then like you feel good for Marissa Tomei, like
Gosh, I had
like
no
she
idea.
has her comeuppance and everything, and
Which is great. Her character was fun. Also, I had no idea how beautiful she was.
Oh, yeah.
I had no
Oh,
idea.
yeah.
I have this whole time been sleeping on this. And then all of a sudden I'm like, oh, that's Marissa Tomei.
Oh yeah,
That's
Yeah.
who we are talking about.
Yeah.
Like, got it.
yeah,
And
yeah.
So yeah.
like when
that
you
was
see the
a wake up
what's she
call.
in Spider-Man? She's in
Yeah,
Spider-Man.
she shows up in
recently, right?
Spider-Man as Aunt May.
Yeah.
And I'm like, wow, she looks great for her age.
That's it.
And I'm like, oh, I think I've seen her somewhere before. She sure is pretty.
Oh.
And now I saw where she showed up.
No.
And I'm
Marissa
like,
Tomei
oh,
is a stone cold knockout.
Yeah.
Doesn't matter the decade.
she is the point of that movie.
Yeah.
But you can't appreciate comedy because you
Won an
have
Oscar
to
for that.
have.
Did she really? Good for
Best
her.
supporting actress.
Crushed it. Such a good role for her. She crushed it.
But you have to have constant comedy.
Yes. Need yuck yuck.
Yeah, that's not what
See,
that's not what those films
That's not
were.
what that. Yeah.
Yeah.
So
I don't know why I'm suddenly saying films, but yeah.
Yeah.
They are cinema.
Because like it's not like I think of like the Marx Brothers. That's a different
Right.
type of comedy,
Right.
Than
Or
My
like
Cousin Vinny.
absurdism, like Step Brothers,
Right.
Anchorman,
Yeah.
Dodgeball. I think that was my genre growing up.
Right.
So like a lot of that old school is that group of guys. You know, it was like
Right.
Will Ferrell, Ben Stiller, Luke Wilson, Owen Wilson. They all rolled together.
Anybody named Wilson?
Yeah, all the Wilsons, Vince Vaughn.
There was that volleyball.
Yes.
Did they do a volleyball one?
Hilarious.
No, the volleyball Wilson.
Oh,
Yeah.
Wilson the volleyball.
Yeah.
Yeah, crushed it.
I
Also
mean, as far as
deserved
your
an Oscar.
situational
Was
comedy,
robbed.
yeah.
Really was robbed. Giving everything to Tom.
He kind of got spiked on that
guy.
one.
Ah!
Volleyball joke.
Welcome to Pot There, everybody. We've got some great questions for today's show. This
That's
is a
good because I did
Whitney-free
not have a
episode.
follow-up volleyball joke.
Oh, good.
Ooh,
Okay.
you burned your only one.
I had a spike. I had spike.
Oh,
That's
Been
all I
holding
had.
on to that. Yeah. Well, we'll try to set you up.
Oh,
There it is. Okay.
Okay,
we can
one
just
more.
Give it a
One
bump.
more.
All right. Last one. How to get the most.
Oh, hey.
Oh.
Oh, it's Annette.
Oh, she's back. She's always hanging around. How to get the most out of therapy. Hi, y'all. I'm starting therapy soon and have my initial treatment plan session scheduled for March 11th. I'm specifically looking to treat my depression and ADHD, which are two things I've struggled with on my own for years. I've been in therapy one time previously, and honestly, it wasn't great. I was put into group therapy almost immediately, which didn't feel effective for me, so I eventually just stopped going. This time around, I'm really determined to tackle these issues. I know there's effort that needs to be put in on my end to make therapy work. So my questions for you are, what are some things I should do to prepare for a therapy session? What should I do between sessions so that I progress and am ready for my next appointment? Finally, do you have any tips or guidance I should think about or prepare for my upcoming treatment planning session? Thank you all. I've enjoyed the podcast for about 5 years now, and I look forward
nice.
to the episode every Wednesday morning.
Oh,
Second time's the charm.
Patreon.
That's a patron right there, baby.
That's a Patreon supporter.
Get that free way.
Patreon.com/therapy.
There it is, because we release it a day earlier for the Patreon community. No ads, and one day with video. But
I
that
have
day
a
is not
question.
today.
I have a question for you guys. Oh yeah, we
fuck
should
this
say on the
listener.
new
Go ahead.
on the show. We haven't
doing
even said it.
Jacob's
Oh, we
question
got all this new studio stuff.
Yeah.
We got video
Fancy pants.
coming.
Ooh, it's
Look
gonna
at us.
happen.
We're doing a beta test on video today, but we're on all new stuff today. Yeah,
Yeah.
it's fun.
Now you'll know that we do not wear shirts when we
That's right.
record. It's a sign on
I
Jacob's door.
dare you.
There's a
Let's
number.
do it.
There's a Patreon number for this. I mean, I have to retire on it.
$20
You're missing a few zeros.
combined between
For
the two of you.
everybody.
Yeah.
Okay, Whitney's gonna be furious. Really, guys? $20? Yeah, we're not splitting it evenly.
Nah.
We all agreed.
We took a
voted.
vote. Give the people what
This
they want.
is America.
Oh boy, Jim sure feels self-conscious.
If you want your
Wah, wah.
opinions to count, you got to show up.
and be a man.
If you don't vote, you can't complain about the outcome of the vote.
Yep,
right.
women's suffrage, all the mistakes of America. You were
right.
saying, Jacob.
I have a question for you two. That this question or that this letter jogged in me. Second time says went into group. It doesn't seem like they were thinking they were going to be in a group setting.
Right.
How often do people go to therapy and end up
Yeah.
in a group setting when they didn't think that they might be in a group setting?
This was going to be my first point.
Yeah.
Good,
Was
because
that-
that was the question that
Yeah.
jogged in my head instantly.
It seemed very odd.
Yeah.
Okay.
Because, you don't see, like
I think of group things like for addiction and things like that.
SUD, substance use disorder, groups are very, very common.
Right.
Mental health,
You
not
people
so
are lousy
much.
with groups.
Yeah.
Oh, yeah. We love groups.
You love a group.
I wonder if the guy or person, they didn't give us any pronouns. I wonder if second time went in to get an assessment and it was an IOP, OP program, intensive outpatient / outpatient. And if they can justify it, they're going to go, oh, you're dealing with depression. We're going to start you on a groups program, which can be a lot. Like, and I can see somebody going, oh, I just wanted to do therapy. And them saying, yeah, no, you'll do that too, but like you've got to come to groups. So if you went to the place that does that,
Right.
they're going to put you in groups. Otherwise, I think it's abnormal that you'd go to like a traditional outpatient and they'd be like, we're going to start with groups. Like a group's first format is usually IOP.
Yes. Also, though, I think now that I think about it, I don't think it's as uncommon as we think. I think we are kind of in a bubble where most of the people that we know are in private practice.
That's true. Yeah.
And private practice,
It's very rare. This
you don't do a whole lot of groups in private practice. Whereas as part of like
Community
large
mental health does.
community mental health,
Yeah.
yes, you're going to see that a lot
Good
more
point.
common.
Yeah,
than
that's
that.
true. That's true. So some of the code words we're using here, in private practice, obviously you have individuals, they have their own little businesses, they're running that all by themselves. It's not in their best interest to usually form groups. That's hard to do logistically. They're usually going to have one-on-ones. Whereas community mental health, as we're talking about, is sort of like the larger nonprofit, big picture groups. Or it could be like an employee assistance program. Like when they're the volume model, the
Gotcha.
quote unquote factory, it's extremely efficient to host groups first and try to get people in there. But what's interesting about that? I'm actually teaching the groups class at UNLV right now. And one of the things that we try to teach the students, which is scientifically accurate, is that groups are as effective or more effective than individual therapy.
Yeah, because I was going to kind of call you out as far as like the factory approach, because
Right.
that almost kind of sounds
Makes it
negative.
sound bad.
And it's
yeah.
not really.
I mean, bulk. Yeah.
I wouldn't say that group versus individual. I don't have an opinion on that, but I would have an opinion on if you had an idea of what that therapy day was
Yeah.
going to look like, and
You
it
don't
suddenly
think
looked
you're
different.
going into group.
Yeah.
Anybody who says today's the day I'm going to do therapy,
Right.
They think it's the one-on-one,
Right.
And so for a place to say, "Hey, we've assessed you. We think you should go to group," you don't see that coming. And so a lot of people end up chickening out of, or not chickening out, but like that's just not what they thought they were going to
Right.
do. It's hard enough to open up to one person. Now they're opening up to a whole room.
Exactly.
It's very hard, especially if it's a rolling group and you're not all starting on the same day and having session one.
Oh, I see.
That's really hard because then you're the new guy.
Right.
And it's like going to a new school and like everybody else already knows each other.
This guy's been here for 12 years.
Yeah, exactly. Here comes this guy and you're like, "Oh, what's your story, man?" It's like, "I'm sad." And like, "Great. Tell us more." And like, "No, I don't know any of you."
Yeah.
So that's actually really common. I mean, we will see that, but yeah, I mean, some of these questions here, what are some things I should do to prepare for the therapy session? And I think we kind of get that question twice. Like in general, what should a person do to prepare for a upcoming therapy session? Also this question of, I have my treatment planning meeting coming up. How do I get ready for that? I think that's a really good question. I'm glad he's asking, whoever, no pronouns on this. But I'm probably going to default to he. Sorry. It's just, I mentally assume that you are a guy. And then what should I do between sessions to make progress? I feel like over the years, Nick, I've heard you talk a lot about several of these points. One of them, you are a big believer in the in-between sessions being as important, if not
Yes.
more important, than the actual hour together.
Yeah, because that's the boots on the ground.
Right.
That's when you actually, in the therapy sessions, you get to learn a little bit about, you gather insight about kind of who you are, some of your behaviors, some of your ways of thinking.
Mm-hmm.
And between sessions is the behavior part.
Right.
That's when you take this information and this new insight and figure out how do you utilize this for behavior change.
Right.
And so, and it really just kind of depends on your therapist and who you're working with. But like for me, every one of my clients, when they left the session, they had a behavioral assignment that they were going to do. From now until the next session, you're going to practice this behavior.
This is the homework.
At least 3 times from now until the next session, you're going to do this thing.
Okay.
That was the homework. And then we had something to talk about when they came back. What worked? What didn't work? What did you learn? What were some of the obstacles that got in the way? Let's talk about all this. And so that's kind of the strategy part behind it, but the actual implementation is between sessions.
Yeah. And I think it's important to note that, like, I've definitely had a lot of patients who will come in and say, "I want homework," right? Like, tell me what to do. When I get permission to do that, I'm excited for it. Like, I have tons of exercises I want to do, but I never can read the person, like, if they're going to do these things, if this stresses them out. Some people really dislike that, and so I won't do it. And like some of what you're talking about, we might describe that, and you might disagree with this description. But I would forgive somebody who hears your style and says that sounds like behavioralism, right? Like he's conditioning, he's allowing change to set in. He's trying to develop new habits. It's an atomic kind of approach. I would understand that there's a lot of clinicians out there that say that's not my jam. Like I don't want to do behavioralism. I'm going to do more contemplative work where, we're just going to reflect, in session. I'm not necessarily going to give them marching orders. And so I guess if you're the patient in this scenario, how do you maximize that like between session progress? If there is homework, I want you doing it. If you're open to it, I want you requesting it, because I know for a lot of us, it goes a long way to be told that you're cool with it and you're welcoming of it. And then we have permission to follow up with you on it and you won't feel burdened. If there is none of that and you don't get an assignment from the therapist, I think that I want you doing like journaling and self-reflection. I want you noticing highs and lows every day. If whatever the presenting problem was, I want you monitoring for that every single day. Did you notice that you were having cravings? If you're dealing with depression, did you notice drops? What accompanied that? What did you do about it? How did you prevent it from getting worse? What did you do to make it better? What are you doing differently? All of that data gathering to me is extremely helpful because I can't follow you around 24 hours a day, 7 days a week. So I need you to be self-examining as much as you can stand to be, and then bringing that to me so that I can parse those details, go through that with you, ask leading questions, take you further through this, and then, maybe coming up with game plan and blueprinting that I want you to do. So I like both of those, suggestions for making the progress. You're a big believer, and as you should be, but you are an advocate for treatment planning. We all believe in it, Tangeman. Okay, we all are with you. You're just more preachy. Yeah, Jacob, a little bit loosey goosey. His life coach treatment plans.
We'll see.
I'm going to be honest with you, they're missing some elements. Okay, they're not exactly what you call textbook. But as they're in a textbook. He writes them in math books that he gets from Goodwill. He's just trying to save money on paper.
They're in a textbook.
That's right. Not arguing the point. So as we prepare for a treatment planning session, I like that second time is asking, what can I do to prepare for this? Because for me, and I don't know how you feel about this, it really annoys me when somebody shows up and just expects me to like lay out the blueprint. Like, I will do the architect work, but like, you need to be setting the goals. You decide what it is we're working on here. And if they're just like, I'm just here because I have to be, like, what do you want me to do? I'm kind of like, where's your buy-in right now?
So that doesn't bother me quite as much because, and I guess because in my experience, that's what every single one of my clients came into that session with.
Low contemplation.
Yeah. I mean, contemplation or pre-contemplation state of change, where they don't see a problem. They don't know whether they're there because someone's forcing them to be there.
Right.
So that's the majority of my experience.
Right.
It seems like just yesterday that me and Nick met like that.
Yes. That's here because I'm forced to be.
Yeah.
Yes.
Yeah. I believe we were at a Marshawn Lynch press conference.
But I think like that's kind of also the therapist's job.
Yeah.
To be able to elicit something out of that. Like, oh, okay. You're here because you don't want to be here.
Let's move
perfect.
with that.
What is it going to take to get that pressure or that force, that driving pressure off of you so that you can go do something
How do I
else?
turn that into objectives and goals?
So here's a general question for you fellas. What is kind of preparation for therapy as far as goals go? How goal-oriented do you want to see a new patient coming into therapy? Like, in a perfect world, if a prospective client comes in for session number 1 and they have a list of goals written out, is that best case scenario, worst case scenario, somewhere in the middle?
Me personally, I would prefer they not do that.
Oh, really? Okay.
Yeah.
Okay.
No,
Why?
I want to come in with a blank slate.
Oh, okay.
You want to figure out the goals together.
Yes.
Okay.
Yeah, because I think if somebody comes in with that, let's just roll with that.
Yeah.
There's not a problem with that. I could still work with somebody who came in and they're like, all right, here's a list of the things that I want to accomplish. But I would still divert a little bit, because then my question is, wow, this is great. You came up with this all on your own.
Right.
What has kept you from achieving this on your own?
I see.
Okay.
Yeah.
Like, what is my role here?
Okay.
If it was this simple, you would have already done it.
Right.
So there's obviously some obstacle.
And then when they
that
say
you're
cheerleader,
not-
that just puts Nick right in his place.
I get it. That's right. Always default to the cheerleader.
When if it's this clear and it's this easy, you would have already done it. So that tells me that there's some obstacle there that you aren't even aware of yet.
Right.
Okay.
So instead of having this list of stuff that you want to accomplish, let's spend some time trying to figure out what that obstacle is.
Right.
And that's going to become our primary objective.
Okay.
Is we're going to identify this thing, and then we're going to figure out ways of overcoming it.
So you want to work with them to suss that out. And
Yeah.
if they come in a little too headstrong, thinking they've got it all plotted, that becomes blindness to you, where it's like, hey, can we work on this together?
Yeah, and a lot of times it's because they have had some time to think about this, and the stuff that they're bringing in, like, again, I'll say it again, if it was that easy, you would have already done it. So
Right.
the other reason that sometimes this happens, if it's not an obstacle that they're not aware of that's kept them from achieving this, it's the locus of control is off.
Mm-hmm.
Like, yep, I've got this stuff. All I have to do is I need to get my wife to stop doing this behavior.
Right.
And then I'm good.
Okay.
It's like, okay, well, that's not going to happen.
Yeah.
Because we're not going to create a treatment plan on changing someone else's behavior.
Got it.
That's never going to happen. So what we have to do is we have to figure out what is actually within your locus of control that you can actually implement. So for me personally, to answer this question for the writer, I would say maybe just just come to your first session with some idea of what your preferred future is.
I like that.
Right. We know what you don't want, right? You're dealing with depression. You're dealing with ADHD.
Right.
You want to not have those things anymore.
Right.
So what would you like to have instead?
I like that.
Right. Kind of be able to paint a picture for your therapist of what you would like your life to look like instead of what you currently have.
I like that a lot, which is, it's a form of goal setting, but it might maybe call it outcome setting. And I agree with you because then that is the therapist's job then to sit down and say, okay, let me build a transport mechanism that gets us to this kind of life that you want to live free of these symptoms, or this is what would be different. I'm with you on that. I generally like the person coming in with some kind of direction, because sometimes I'll get the person who is really difficult to read and they're just so neutral, and I'm like, so why are you here today? What brings you to therapy? What, tell me the backstory. And it's so benign. And they're like, I don't know, people in my life are worried about me, so I'm here. Or I just thought it'd be cool to come talk. And it's like, okay. And like, I run a private practice, so I don't need a diagnosis to drive it or whatever. So I'm like, that's fine. But then it's difficult sometimes to suss out, like, what are the objectives? And I've had people that are sort of like, yeah, man, I don't really know, whatever you think we should be working on. And that, to me, then I don't get sassy, but like, there's a part of me that's like, I don't know how I feel about that. Like, I feel like if you're going to
get sassy,
you're going to make the appointment, you're going to come here. Like, what do you want to do? And it's like if somebody scheduled personal training and you're like, so what do you want to work on? They're like, I don't know, whatever you think's best. And they're like, okay, do you want to get healthy? And they're like, I don't know. And it's like, really? Like, even that baseline thing that you associate me as a personal trainer with, just health or strength or muscle. You don't even have that.
Even in that example,
what do you want to do?
Even in that example, I'd be fine with it.
Okay.
Because my approach then would be like, all right, cool. Well, we're going to go over the basics.
Okay. So you'd start with a primer.
So I'm going to teach you some good warm-up exercises. I'm going to teach you some stretching. I'm going to teach you some basic movement analysis. We're going to dip our toes a little bit into maybe some steady state cardio. Let's do some high intensity stuff. Let's do some resistance training. And then as we continue through this, then I'm going to rely on feedback from you.
I see.
You tell me, what are the things that you really feel motivated to do? And what are the things that you really dread?
So I see like how in personal training land, that would work very well. Because it's like, great, you're here. And you're giving me complete authority. I'm going to just start designing things. And if you're cool with it, you're not going to put up a fuss. Let's have you do it. And then we'll figure out something together. We'll discover together what you want to work on. I can see in a clinical setting, that being hard to have an indirect conversation about like, well, let's talk about your parents.
Well,
They're
it also
great.
kind of depends.
Okay, strike one. Let's talk about your relationship. I'm happy. Awesome. Let's talk about depression. I'm great. All right. What the fuck are we doing here, John?
But here's the thing. Like in this particular example, you're not starting from scratch.
Yeah.
The writer identifies
that's true.
ADHD, depression.
Right. Yeah.
Like, okay, so that's your jumping off point.
That's a great jumping off point.
Yeah. So tell me about those, how do you notice this? What are some things that you've identified?
Right.
Tell me your symptomology. Tell me how this affects your daily life.
Yes.
What would it be like to be able to live with depression but still function?
These are the things that I want Second Chance to write about. So to prepare for that treatment planning session, exactly what you just said. What would help me is if they've done some thinking and done some writing about how does your depression manifest? So what are your symptoms? What are your personal symptoms of ADHD? Any history that you can just remind yourself about, like how long have you noticed these things? What have you tried that didn't work? What have you tried that's made it any amount better? And then going to your outcomes point, like, what do you really want to happen? Like, what is your personal view? Like, do you want to live a world in which ADHD doesn't exist anymore for you? That might be unrealistic. Do you want to live a world that you learn how to manage depressive spirals or that it's completely evaporated?
Right.
These are different objectives, right? And so I like that your framing of that allows them to come in with some thinking that we're probably going to ask about. And so if they can do that homework, then the conversation is going to be hand in glove. It's going to work really easily.
Right.
I like all that.
Yeah. I mean, even in your example too, of like, well, I'm just here because people are worried about me, you know.
Just here so I don't get fined.
Yeah.
Yeah. Well, what are they worried about?
Yeah. All right. What are they saying?
is.
How do they express concern?
That's right.
How do you feel when they express this concern to you? You know, there's so many, like when you get really into, you know, therapy,
Like you still showed up.
yeah,
Right.
There's so many jumping off points when you know how to ask a question that drives the person to like a specific way to answer it.
Which is very motivational interviewing based. Yeah. How to back them into that. So second time, this is a great question. We're glad to hear that you're working on this. We love that you've been a part of our show for 5 years. We love even more that you support us at patreon.com/therapy. And I'm excited for you that you're setting a treatment planning session, that you're willing to do the work in between sessions and that we can give you some feedback on that. And then just trying to lean in on each session, coming in with that thought, you know, kind of self-analysis, self-examination. That's going to be the stuff that your therapist is going to be looking for to learn and to be curious about. And that way they can find those little nuances to kind of figure out where to wedge between you and the problem and try to make it a little bit better. But love this question. Love that you're leaning back into it. I think you're setting a great example for other people and wishing you the best success, man. If you keep working it, it gets better. So just work it until you, get to the finish line because it will appear, and advocate for yourself. If you are assigned to a group system, and you've already tried that, you want to let them know, hey, I've tried that. It wasn't a good fit for me. I definitely am not interested in that.
Right.
Advocate for yourself because usually they'll say, okay, well,
I don't
everybody
think-
kind of complains, but fine.
Most people are not going to put you in a group against your will.
No, yeah.
like
if you're ambivalent, they'll say, will you please give it a try? Which they should. And we don't want to say that group doesn't work. The stats are that it does.
Yeah.
But it is off-putting and it's a little bit deeper water than I think a lot of people are ready for. So, But yeah, you've already tried it. So you've already done your due diligence.
Yeah.
If you want to go individual, do it. But good job with that, man. Stick to it. It'll get better. We're going to take a quick break. And when we come back, we're talking about dating in your 40s.
Hell
You're
yeah.
listening to Pod Therapy After Dark.
In space.
In space.
Today's episode is brought to you by Robert Brownie Jr., Mintz, Kayla Lansbury, Kevin Chamberlain, Ben Stanley, Adam Hathaway, Dan Martin, Lib, Hey Yo, Andrew Langmead, Chad Mag, and Inka LaPrince. Would you like to sponsor the show? Become a therapy producer at patreon.com/therapy.
Everything's better in space, including dating in your 40s.
Jim, continuing on from our thing last week, stuff we didn't know.
Oh, very little I don't know, Tangerman.
Barbarella
Okay, we'll see
in
about-
space.
God damn, that was a good movie.
Grease in space.
Oh, yeah.
That's already Barbarella.
I got chills. They're multiplying.
Why do airplane windows have a tiny hole near the bottom?
Oh, shit. I have noticed that.
Well, that's good.
All right.
I'll give you a point for that.
Yeah, what is the deal with that? Oh, that's
Jacob,
really
have you noticed that too?
uncomfortable.
I have.
1 point to Jacob.
All right, we're all winners here.
We're all tied.
All right, so it's 2 if I shoot from the hip, 1 with option.
Sure.
Fuck, I think I know what it is, but I'm too scared. Give me
What do you
options.
think it is?
Well, no, if I tell you he's going to put it in the fucking lineup, he always
will
does this.
do that.
It'll always
That's
be
not-
option
that doesn't
D.
sound like
Whatever I
Nintendo.
say, it'll be option D.
Okay.
Your option D.
I like to consider myself everybody's option D.
It's for drainage after rain.
Oh, that kind of makes sense.
It helps equalize pressure between window panels to
That's
reduce
what I was
fogging.
thinking. That was the fog. I didn't know, but pressure, yes. That's what I was thinking.
It helps equalize pressure between window panes and reduces the pressure between the panes.
Fuck you in the neck.
It helps equalize pressure between the window panes.
Damn it! Fuck.
That's
this
it.
Game.
It's a manufacturing alignment marker.
Oh,
It whistles if the plane goes fast enough.
I like that one. All right. Give me pressure equalization.
Which one?
God damn this game. The first one that
Does
was
it
legitimate.
reduce fog or does it prevent cracking?
I'm going with
what does
reduce
it do?
fog. Give me reduce fog.
Okay, yes.
Yes.
All right, Jacob. Velcro is a hook and loop fastener.
Yes,
True.
it is.
The original inspiration came from what?
Ooh, I know this one. I can steal.
I've heard this before.
You better get options, you coward.
What is this? It's the hook and loop.
Yep.
And it's. Give me the options.
Yeah.
Spider silk,
Yep.
Burrs sticking to clothing / fur. Tree sap. Coral structures.
I'll say the burrs.
It is.
Yeah.
Damn it. Thought I got him with that spider one.
Jim.
Tie game. 1 up.
The zippers, and some zippers lock when the pull tab lies flat. How?
When the pull tab
lies
flat.
I know this one. I can steal.
Oh, boy. Give me options. I don't even know this.
Well,
was
what do
a
you
thing.
think it is?
I don't even know what this is. So when you zip up a zipper, you're holding the flappy thing. And they're saying that some
When the
zippers
flap-
will only lock when you push it down?
No, when it goes flat, it locks. It locks in place.
Oh, so it won't move anymore?
Yes.
Yes.
I've
that's
never
what they
even
mean by
seen
lock.
such a thing. The only zippers
Yes, you
I know
have.
are the ones on my fucking pants. Like, those don't lock. Never seen a locking zipper.
All right.
So, yeah, I'm fascinated to discover
Buzz.
this. No, there's no buzzes. Don't you give him anything.
Buzz.
The fabric shrinks slightly. Or how does it work? The fabric shrinks slightly. A small internal pin lock engages the teeth when the tab is down. The teeth become magnetic. Or the slider tightens like a clamp.
Oh, God. Jeez, guys. This is a thing? You've both seen this kind of zipper?
Never mind. I've never heard of any of this.
Okay, good. Spider silk is the answer.
I'm kidding. I know which one it is.
Fuck me. I'm going to go with the you push it down in a pin thing.
Yeah, it's definitely that one. And all the zippers on your pants definitely have it.
Yeah.
So
the zipper on your pants right now probably has that.
When you push down the zipper, it
No,
locks?
look under, like lift up the zipper, like lift up the little flappy thing.
Yeah.
And look underneath it, and there's like a little piece of metal sticking out underneath it that hits the zipper when it lays down flat.
Oh, well, there you go.
Look at that.
Wow.
Yeah.
I definitely have
Correct.
that. All right. Well,
Also,
now I know.
it's B, as all the answers have been so far.
Great. Good job, ChatGPT.
Oh, no, this is Emma.
Good job, Emma. GPT.
Emma GBT. All right, Jacob, last one.
Hit me.
What's the purpose of the little plastic metal tip on the shoelace?
Oh, I even know what
Aglets.
it's called. Oh, damn it.
Plastic or metal tip on the shoelace?
I believe it prevents it from fraying.
Don't forget it.
Correct.
Yeah.
Prevents fraying
Together.
and makes threading easier.
All you
2
Phineas and
points.
2
Ferb
points.
Fans.
Jacob's
that is
got the
for you.
lead.
Oh, Jacob's got the lead.
Shit. All right. Fuck. It's fine. It's only
And knew
halftime.
that Jim Zipper.
Yeah.
I already knew all about Jim Zipper.
I'm very concerned about that, by the way.
I can tell you anything you want to know about any of the zippers on any of your articles of clothing.
Yeah, just very intimate knowledge about all of my intimate clothing.
You know the zipper on that shirt you're wearing right now?
Yeah.
Yeah, I know where that is. I know where that zipper
He
is.
knows about the zipper.
Secret zipper.
You know about the secret zipper on the back of my pants, too? Fuck. All right. Dating in my 40s. Hey, y'all. Hey, all. Sorry, I southernized this by accident. Hey, all. Here is an update on my life. Buckle up. I really stepped in it this time. I had a severe reaction to some new medication which caused serotonin syndrome, and I ended up in the hospital. A few hours after being released, my fiance came back from vacation and immediately ended the relationship and kicked me out.
Yikes!
I was forced to move all the way across town from Mesa, Arizona to Glendale, back in with my mom, all in an 8-hour period. She is keeping my dog, but says we can work out some sort of visitation. I don't know that that's going to be sustainable long term, and I'm grieving the loss of the dog and have little to no emotional feelings about the end of this 8-year relationship.
Maybe that's why it ended.
Yeah, it seems like this was for the
It
best.
seems like it didn't help.
Yeah, but get the dog back. We tried couples counseling, which was only 3 sessions. No couples work was done, so that provider is now my individual counselor because she didn't see a conflict of interest and she knew some of the story already. That's a big help to me. Anyway, I'm conflicted. It's been less than a week and I'm already on dating apps, seeing what's out there, not looking for anything serious, just looking. The last 3 years of my relationship was basically a roommate situation with zero affection or physical touch that I fought and clinged to, hoping I could save it. The realization hit me this is gonna be a difficult road because I just turned 40 and was pretty content and happy not having to deal with the dating nightmare. I'm having thoughts and feelings that aren't normal for me. I've never been a casual dater or looking for a one-night thing, but that's where my mind has been. Just go out and put bodies between us, and if something deeper develops from that, it can be discussed later. I'm finding that there's not a lot of women on the apps my age that are interested in me. A lot of the women that are interested in messaging me are in their late 20s and early 30s and looking to hook up. It's flattering and one hell of a pick-me-up, but it feels weird. There's a part of me who thinks that everyone, especially the younger ones, are just AI, and I've been basically talking to myself this whole time. I'm sure we got sidetracked and Jim is talking about his AI deep dive series on Patreon, so I'll just wait. In fact, I will. Patreon.com/therapy. Listen to the 10-part series so far.
I am sure you can. I am sure that it does make sense to you that all these young people would be AI.
Yeah.
How does that make you feel?
How does that make you feel?
Yes.
That's not who I am. I'm a sappy romantic who wants the real deal. I can't figure out why I'm having those thoughts. To be honest, I know I shouldn't be back on the market so soon, and I have been 100% honest with everyone that I've been talking to about my situation. I tell them up front, I'm not sure what I'm looking for at the moment. I'm open to anything, friendship, casual, or eventually a serious relationship, but not in a huge rush. I'm recently single. My counselor says that she's glad I'm being that transparent up front, and I seem to be handling the loss of my relationship extremely well compared to the anxiety I had in our sessions pre-breakup. I'm sure that I'm missing some info, but just wanted to run these thoughts by you and see what your thoughts are. Sorry my thoughts are kind of all over the place, so if it doesn't make sense, forgive me. No snappy sign-off. Anthony Camarada. P.S. Sent an addendum through Discord. Here's the P.S. I forgot to mention that my friends and family have really stepped up and been a huge support through all this, and I've been feeling nothing but gratitude and surrounded by love. I'm in the presence of relocating closer to my mom's house for work, and even though I'm not looking forward to all the BS that goes with meeting people online, the ghosting and all that, it feels good knowing that all the stress I felt from trying to fix my relationship is over. The realization I wasn't happy myself or was feeling unworthy of love, affection, or even feeling attractive. Working on loving myself is something I neglected for a long time, and I see that now. I'll keep you all in the loop as I keep moving on and rebuilding my life. Thank you all for the supportive community you have built. You are truly amazing. I will rejoin Patreon when I get back on my feet. Signed again, Anthony Camarada.
Hey, Anthony.
Woo!
There it is. Also, a very lovely off-air note was submitted as well, just saying very nice things about the show and deep appreciation for what we do.
Oh, thank you so much.
We do appreciate you, man.
Do people not talk about rebounding anymore?
Okay.
So,
Is that just out?
Yeah.
No.
Okay.
Because when I got divorced.
Which time?
And fuck you.
Oh, sorry.
Well, that's what we're asking.
I'm a little bitter about the trivia.
But fair.
I'm a little salty, and it's coming out.
But fair. The second time.
Maybe if you ran a clean game, I wouldn't take the shots. Sometimes you got to bully the ref if you want an honest game.
Yeah. So right afterwards, I met somebody, was dating them, and then my friend's like, "Oh, the burner."
Oh.
And I was like, "What do you mean?"
Oh.
And he was like, "She's a burner."
Yeah.
Like, this is not, it's like, don't go into this as a serious relationship. This
Okay.
is just, you're letting off steam.
Yeah.
You're just like,
Get to know somebody,
just- yeah.
practice doing
Yep.
dating again.
exactly.
Okay.
And so, yeah, that definitely, I think, is a thing. And I that's kind of that kind of became my approach then, is just like, okay, I'm practicing. You know,
Okay.
I'm just practicing, meeting people, having conversations with people that I'm trying to form a relationship with, because that's like
Right.
a new skill that you kind of have to learn again. And yeah, but I guess the other thing though, Anthony, is to kind of ask, because you kind of said like you're not really sure what you're looking for at this point. So I guess maybe that'd be a good question to ask, is kind of like, why are you on on the dating apps anyway?
Yeah, kind of
Like
answer
what-
that question.
Yeah. I mean, because something drove you onto that point, onto
Right.
that platform, right? And like for me, it was mostly just fear of being alone,
Right.
And then so whatever that thing is, you're going to meet that type of people,
Okay.
because it's kind of like this radar thing that we all have.
Sure. The vibes you put out
yeah.
are the vibes that are picked up.
Yeah, and so you're attracting a certain type of person based off of whatever your intent is,
Yeah.
and whatever you are internally feeling.
Okay.
And so if you're just kind of feeling like, I don't want to be alone, I don't feel good about myself, and I just need a warm body, then you're going to find people that will fulfill that role.
Yeah.
Oh, yeah.
Yeah, for sure. I also think it's interesting. I'm not at all surprised that Anthony's noticing he's getting a lot of attention. I think it surprises him because he's sort of like, well, I'm letting people know I don't really know what I want, and I'm letting them know I got out of a long-term relationship. I would think I would be kind of radioactive because I just got out of a long-term relationship. I think a lot of people really like that, actually, because then they know you're not just a serial dater, that you're not just sitting here fooling around. Like whenever somebody's like, hey, I just got out of an 8-year relationship, that's almost like really great news, I think. Like I think a lot of people go,
I did not have that experience.
Oh, really? Okay.
No, it
maybe
was
I'm
opposite
misreading
for
it
me.
then.
I don't think it's that, but I do think that people hear that and read that as a code, like, oh yeah, you don't know what you want.
Okay.
But I see what is happening here. You're coming off of a long-term relationship.
Yeah.
You're on here to like Nick was saying, like you're blowing off steam. I think people see that. I think people recognize that in other people.
Let me give you the theory. Let me give you the theory of the pitch here. I think the other person goes, oh, maybe I am looking for a long-term relationship. This guy is capable of a long-term relationship. So like same thing as an employer. If it's like, oh, I see that you switch jobs every year.
Gotcha.
I don't know how I feel about this, but it's like, oh my gosh, this guy was 10 years with Microsoft and we are Apple. I would like this guy because this is a 10-year guy. He's not going anywhere.
You're saying that they see spouse material.
The resume says relationship material. Even if the person says, I'm not sure what I want, I'm here trying. The other people down on the other side are like, oh, but I can see what you're made of. Like you're an 8-year guy.
But you've still done
You're not fooling around. Like, yeah, I want that kind of person because you're capable of it.
Okay.
I would still push back on that.
All right.
I'm still not buying it. Because I think most people, if you go out there on the dating apps and you're like, yeah, I just got out of this really long-term relationship, I think most of the women that are looking for somebody, relationship material, they see that and they're like, oh,
it's going to be a while.
You're not ready yet.
You might not be ready.
You're not ready yet.
Okay.
And whereas I think women who are just kind of more like, I'm just meeting new people, I'm just kind of going on dates. It doesn't always have to be just sexual.
Right.
But just like, I just want to meet new people. This guy seems safe because he's non-committal.
I think that's a big part of it. So like, and obviously it's a great episode for Whitney not to be here. I'm really relieved because I don't want her with her blah, blah, blah.
We should still fill in the gaps and see what we think she would say.
Yeah. Something pew pew Texas.
Yeah.
I think it kind of goes both ways. If I'm the woman in that
should
scenario,
say something mean about Peter.
Yeah, she would just save Peter.
Hashtag save Peter.
If I'm the woman in that scenario and I do want a long-term relationship, I look at that guy and I think you're right. I do size him up and think it's pretty soon. He's probably not ready. But I also look at that guy and I think he will be more likely to be ready at some point and be a long-term relationship safe bet because another woman already did this for 8 years. So like that's almost the social proof signal of like he's capable of it and he held it together for almost a decade. That's somebody who's comfortable with the concept. And that's probably how he's wired. This might be early and it might not be right. But if I don't get in now and take that shot, then I miss that shot. That's a Wayne Gretzky, Michael Scott, moment. Mm-hmm. Whereas the other fuckboys on the app, I already know what they're about. So the odds that one of them transforms into relationship guy is much lower than relationship guy is ready right now or not ready right now. I'd rather take my shot on that guy and find out if it's a good fit.
Yeah, I think kind of the difference though, like in Anthony's position versus kind of the fuckboy position.
Spelled
is
PH,
just
by the way.
You're right.
Yeah, B-O-I.
Is just kind of like
they're from the fuck region.
Yes. Yes.
Of France.
Mm-hmm. Yeah. Otherwise, it's sparkling douchebag.
But like I think it again, like I think it's kind of more of like a safety thing.
Yeah.
Where it's just like, yeah, we both know that this is going to be casual, but I feel like I'm not going to be abused. Or I feel like
all right,
it's casual, but you're not going to
You're not a heartbreaker.
Me.
Yeah. You come from
like,
the right stock.
You
here.
can be respectful in what's going to happen here.
Right.
As opposed to just like, oh, you're just going to do this thing and then go tell everybody about how it was and then on to the next one,
right?
Type thing.
Yeah. Jesus, what has Nick been up to?
Oh, you know what I've been up to.
Yeah, I think it's really interesting. And also, I think we did, I want to say in season 2, we reviewed some very interesting data that had come out that time where they had done this huge analysis of dating apps across the country in major metropolitan areas.
Yeah.
And we're basically trying to figure out which type demographics of profiles were getting the most attention. And it was a way of kind of showing like, is a college degree attractive? You know, what ages are attractive and things like that. And one of the really, I think, surprising takeaways from that data was that men, their attractiveness, according to the app and the attention that they get, actually was peaking in their 40s. And like, that was something people didn't expect to see because you just, you know, younger men are more attractive or whatever. And like, they're more aligned with the bulk of the dating pool, right? Like the majority of humans on the app are in their 20s and 30s and petering off into their 40s and stuff. Like the bell curve starts to drop in that side. But the men who were getting the most app attention were actually in their 40s.
Seems like Jim knows an awful lot about these dating apps.
There was data. It was data.
Yeah,
you were there.
It seems like Jim just knows a lot about these dating apps.
A man hits his sexual prime in his 40s. Okay, I think we all know this, and the data backs it up. But I'm telling Anthony
trying to hit
that
my sexual prime.
Okay, but I'm just trying to say for Anthony, hey, that actually, and there's a lot of men I talk to that, you know, end up single in their 40s, and they're really discouraged because they think like, who's gonna want me? I'm in my 40s. These young guys are out there in 20s and 30s. And they're always really surprised to discover the attention that they end up getting. Yeah. And when it happens, I usually tell them, I'm not surprised you're getting all this attention. In fact, I have seen data that corroborates that attention. Yeah. It's not bad. Like, and I think that's really encouraging because I think there's a lot of reasons people might be discouraged in that decade to feel like, oh, well, I'm past my prime and I'm not young anymore. And like, who's going to want me? I'm kind of already lived my life. But actually, for whatever reasons, a lot of men are described as more attractive in their 40s.
Yeah. I had that fear too. Like in the divorce, afterwards, I was like, oh my God, well, I like the clock is ticking. I got to find somebody else if I want to, you know, otherwise I could be, you know, alone the rest of my life.
Right.
Because I'm already 31.
Right.
You know, it's like, oh my God, I'm so fucking old.
Yeah.
If I don't find somebody soon.
Right.
And now
who's
it's
gonna
like,
want me?
Dude.
Yeah. You realize, no, it's fine.
Yeah, you're fine.
Yeah.
This is the best years of your life.
Yeah.
Yeah. You're going to be all right.
Which I think is a good note to give Anthony too, because, and this is advice that I usually give guys that find themselves suddenly single in this era of life. A lot of times they start with feeling low self-esteem. I'm not going to be worth anything. Nobody's going to want me. And they start putting their foot in the water to like see what's out there with the market. And they're surprised by the attention they get. And a lot of times, especially if they are a serial monogamist or like coming from long-term relationships, they're not good at playing the field. They're not good at just kind of shopping and dating because they've never done that. And so like they attach really quickly. And they're so flattered with like the first woman that shows them all this interest and attention. And so they tend to lock down really quickly. And usually the advice I'm giving them in therapy is, hey, let's agree together. Let's set an arbitrary amount of time that you're just not going to be in an exclusive relationship. And what does it look like for you to communicate that to people that you're dating? That like, hey, I am dating right now. I may not just try to date as many people as possible, but anybody that I get to know, I'm giving myself this long before I enter my next relationship. And like, do you agree with that, Anthony? And it's okay if you say no, as soon as I find the right person, I'm going to be in a great relationship. But I would argue therapeutically, would you know that when you see it? Because you don't have a lot of experience. You spent the last decade with one person, spent your 30s with one person. And I would be curious what his relationship resume looks like before that. Mm-hmm. Some people have only been in serious relationships and long-term relationships. And they have this low self-esteem. They're going through stuff. And like, I kind of want them to just, it's kind of like whenever you're in the housing market or like the car market, which I'm sure all the women are like, this is why we have Whitney. So that Jim doesn't fucking reduce an entire group of people to buying a house.
It's like when you go to a pet store.
Yes, exactly.
And you see
the first
pin
one
of all the old dogs there.
Yeah, there it is.
And you go like, well, I might as well pick one of them.
Yes, that's what it is.
Yeah.
It's like when you're in the housing market and it's like the first nice house that you see, you don't know if that's a good value or not because you have not seen enough houses. So you should guarantee yourself, I'm not buying anything until I've gone to at least 10 houses. Only then do you understand a good value when you see one.
I also agree that there is a big
That's how women should be talked about on this show. Whitney, please come back. Hate mail, PodTherapyGuys at gmail.com.
No. I disagree. Whitney would just be saying you should sleep with as many women as you can.
That's what Whitney would say.
That's what Whitney
You know
would
what?
say.
We know her well enough to, I think, speak on her behalf.
Yes.
In fact, let's just say that Whitney said what I said. And I'm on the other
There you
side
go.
going, wow. Whitney, how could you?
I cannot believe.
Yeah.
she just said that.
Jacob, how hard is it to AI my voice into a Whitney voice, and we could just say she was here the whole time?
Super easy.
Okay, great. Let's do that.
Yeah. No, that's it. That's it.
But there is similar to dating and buying a home.
Yeah.
There is that fear of like, oh my God, like the perfect house or woman.
Yeah, same thing.
Whatever.
Yeah, car.
Is out there.
Yes.
And if I don't get out there right now and find it, I could lose it.
Yeah. And there's an argument that the first house you see is the best value, but you didn't know that yet. So maybe you should have just gone with your heart, which is why I'm an idiot.
This is why you sleep in multiple houses before you buy one.
How do you feel about 2 houses at a time?
I mean, it's 2 mortgages.
How is that possible?
Yeah. Well,
You
I'll show
only
you some
sleep-
videos. It's possible and fantastic.
But like I had this like when
Menage a roof.
when I was dating.
It's called a cul-de-sac now. If you're nasty.
Because I did have that fear of like
No outlet.
that the perfect person is out there, and if I wasn't active, like I could miss this window,
Right.
and not realizing that like statistically
Yeah.
how unlikely that is,
Right.
you know.
Yeah.
And most people suck anyway.
That's a good. See, I hear this all the time. People say there's plenty of fish in the sea, but it's like the fish outside of a nuclear reactor.
Yeah, like,
They all have 3 eyes and
Yeah.
weird fins.
Yeah.
Like, I don't know if I feel good about
But
that.
like, even that is like that gets into like predestination stuff and everything. And like,
yeah.
you're not gonna find somebody for a good relationship until you're ready to be in a good relationship.
Yep.
That's a really good point too. Is
Like you have to be ready for it.
should
Yeah.
you be going out there meeting people before you are ready? Because what if you meet a great
Well,
person,
that's-
but you fuck
But
it
I
up
think
because
that's how
you're
you
not
get ready.
You
I
gotta
think
get
that's
out
how
there
you
and-
get ready.
So like a batter, you got to get out there and take your cuts.
Yeah.
Okay, yeah. So that's how you get ready for the right woman, is you plow through a bunch of wrong ones.
But again,
That's what Whitney would say.
Whitney,
Yeah.
we're on the same side.
if you go look at the
Other Whitney, I agree with you. I, Whitney, also agree.
if you go look, I know it sounded a little confusing there. Whitney sounded a little off there. Trust me, that was Whitney.
That was all Whitney.
Yeah.
So is this person and that one.
But yeah, like, it is that whole like you've got to be ready for it.
Yeah. That's
And
an interesting
I
point.
don't know how else you get ready for it. And like if you go house shopping to for some reason extend Jim's metaphor.
Whitney's metaphor.
Oh, sorry, Whitney's
Talked
metaphor.
about this,
Yep.
Whitney.
And so if you want to extend Whitney's weirdly sexist metaphor
I was
about
against it.
house buying,
Hi, Jim, and I'm against it.
like you might go look at a house
Yeah.
and decide you're going to look at some more, and you might go back to that house.
I could see the argument from the other side that says if you're not ready, don't even bother getting into the game.
Well, because here's the thing. Your realtor knows where you're at.
Okay.
Right? And your realtor understands what you're asking for.
Yes.
And if you don't know what you want,
Right.
and you're confused, your realtor is just finding houses for you that fit your current
Okay.
description of a house.
So this is a pimp?
the house that you want right now
Yeah.
is not the house that you want to settle into for the rest of your life.
Oh,
Okay.
I see.
But
you don't
your
want to take
realtor-
one of those houses home to meet your parents.
I see
Your
where you're
realtor doesn't understand that yet.
at. Okay.
Right? Because right now you think
I want a hot tub.
I need an in-ground
That's
swimming
important.
pool.
I need an
I
in-ground
have
swimming
to have
pool.
an in-ground
Yeah.
swimming pool.
I need a tree house.
And so your realtor's like, all right,
Right.
well, that's what you say.
I want nipple
I will
piercings.
found you. I will
Right.
find you these houses.
Yes.
And it's not until later that
Non-negotiables.
after you've seen several houses that you're like, you know what? I figured out
Yeah.
I'd rather have a 4th bedroom.
I see what you're
I
saying.
don't really need this other
The
thing.
gazebo.
I see.
Don't need the gazebo.
Yeah.
And then now your realtor's like, okay, I get you,
I
fam.
see what you need.
Now I know what you're asking for.
Okay.
And then now the houses that become available for you are much hotter.
Oh, I see. Because of the weather.
Right. Because of the weather, because it's getting warm.
And it's a better fit, is
Yeah.
what you're saying. So I guess I'm just curious. Do we, it feels like everybody's on team. You're going to have burners in this new relationship era, and it's okay to just get out there.
I like to think of it as just practice.
Is there any argument that says don't do that? Do a lot of personal work. You just got to have an 8-year relationship.
I don't think of it as burners. I don't even like. I
well,
just think
Whitney
of it as,
said that.
I don't
Whitney
know why
said that
Whitney
earlier.
even said
No,
that.
I don't know why
Yeah.
Whitney would say that, but like I don't.
I was offended.
But I mean, yeah, you're rebounding.
The argument
it's
that-
the rebound. You're getting out there and you're getting
Okay.
back in the game a little bit.
Is there an argument that says don't do that because dating is not consequence free. You could hurt yourself even further. You might not be ready. You could hurt other people. Maybe
the best way to avoid that is go into it with eyes open, I would say.
Well, what if we told Anthony, I want you to go, you were in a relationship for 8 years. Can you take 8 months and just go to therapy before you get back into dating? Don't even bother with it.
I don't think you need to do that.
Okay.
I think you should take a little bit of time, but I don't think it needs to be 8 months.
Okay. But is there an arbitrary number that we like? That we
hour
say
and a half.
Don't.
Yeah.
On the way home.
Yeah.
By the time Anthony hears this.
Yeah. It's been a solid week.
Pass.
I think Anthony said he didn't have a long drive across town at one point.
That was it.
Yeah.
And he was already.
No, I think. But
Is there
here's
no
the thing.
argument for that?
There's a little bit, but like
I know what you mean.
Yeah.
I don't think that's necessary because I think you can walk and chew gum at the same time.
Okay.
The
So
thing
women
that-
are
the
like
thing
gum
that-
now.
That's what Whitney
Chew
told
'em up,
me.
spit 'em
That's
out.
what Whitney told me.
She says that all the time.
But like, so
She makes us refer to her as doublemint.
I know, which I'm really uncomfortable
Yeah, I'm
with,
not
but
okay with it.
I've been doing it now for years,
Yeah.
so I don't know what to do. I'm not going to question. She makes me call her juicy fruit. I don't like it. I don't like it, guys. I don't like it.
But like, so for me with dating, like it was healthy for me. Like I
Yeah.
was not, there's plenty of women that I met that I think like, wow, that could have been a really great relationship.
Uh-huh.
But I was so fucked up in the head that it was not going to work.
Okay.
Right. But it was still worth it. If I were to go back and do it again, I'd do the exact same thing.
What if you would have burned Laura
No, but
because
hold
you weren't
on.
ready for her yet?
But I hadn't met her yet.
But that's my point.
But that's what I'm saying.
Okay.
That's what I'm saying is at that, I was going to meet somebody anyway.
Okay.
Like that's just how it was going to be.
When you are ready, they
But-
will appear.
wow.
Yeah. But like,
Okay.
but that was good practice because I had to sharpen up on my social skills.
All right.
I had to sharpen up
You
on
wouldn't
dating.
have been ready if
I
you
had to-
hadn't tried.
Exactly.
Okay, that's
you know,
fair.
and
He
so
wouldn't
like,
have had that mad game to spit at Laura.
He
exactly.
did have mad game.
Yeah.
And so
Yep.
it's kind of like you guys have seen the movie Crazy Stupid Love.
So women are crazy and stupid.
That's what Whitney told me.
That's what she said.
But you've seen the movie, right?
Yes, great movie.
Great movie.
Yeah, Ryan Gosling, Michael Scott.
Yep. Michael Scott.
Yeah.
Um,
Stone also.
Yeah, Emma Stone. They're good.
As I've been told, Academy Award nominee.
Yeah. But like that good example of like he got put in this situation and he like learned from somebody else. Like, but he learned to kind of like take care of himself
Right.
through that process. Like,
Okay.
And I did the same thing too. Like, okay, I got into exercise.
Mm-hmm.
You know, I got into
Fashion? You got into
fashion.
men's
Like I
fashion?
started dressing nicer.
Yeah,
you
you
know, I
did.
started doing all these things.
Yeah.
And it was for me.
Used to be a real hobo, man. It was.
Yeah.
It was real.
It was the
bad.
bindle that really
He was
did
like
it.
wearing Skechers. It was a cry for help.
Skechers.
I'm from Brit. That's
That's just what they have.
hobo capital.
Yeah, okay. So I guess I don't see anything unhealthy with it. I guess the thing that I would be very curious about therapeutically is just what the experience is like. And if Anthony gets out there and he starts meeting people, if he starts catching feelings too fast and he notices like I've been so attention starved for almost a decade, and so like I'm bonding really quickly, I'm wanting more with these people very quickly. That's me. But then I'd be
Yeah,
grabbing him by the
but
shirt and
here's
being
the
like,
thing.
slow down there, cowboy.
But
I don't think
that's-
you're ready for this.
No, but that's going to happen.
So he just needs to go through it.
It's going to happen whether he experiences that now or he goes through 9 months of therapy and then he experiences it later.
Okay.
Anthony, your heart's going to be broken.
Yeah.
It's going to happen.
Yeah.
Not if
He's
Jim
gonna-
can help it.
Yeah. I think I
Yeah.
can stop it.
Okay.
Well, but you can see that there would be scenarios that a person could realize through their early dating process that they're not ready for it. And the answer is not
course.
always just do more. The answer could be,
Yeah.
no, I agree, you're not ready for this
No,
right
slow.
now.
If you feel like you need to slow down,
What are
Slow
those
down.
then
flags?
certainly
What are
slow
those
down.
red flags? What would you need to see that Anthony would come back to you as his counselor and say, I'm experiencing these things in my early dating career as I'm rebounding.
I
You'd
think-
say, hey, bud, take your foot off the gas for me. I don't like you doing this
If you
anymore."
start attaching really quickly,
Okay.
like you go on a couple dates and then now you start thinking about the rest of your life with this person.
Okay. Yeah. Too quick.
Okay.
Yeah.
Doesn't show that he's ready for that yet.
Or like, there's always that kind of awkward conversation that you have at, a couple months in, like, are we exclusive?
Whose baby is this? Yeah.
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 Or are you still dating other people? Or,
Right.
but like,
Are you just not gonna go for the taint? Because like, it's right there.
Look, I've dropped a lot of
Whitney,
hints.
Whitney,
Jesus, Whitney.
settle down.
she
know,
is infatuated with that
Not
taint.
very ladylike. Jesus.
God.
I apologize, audience.
Yeah.
We can definitely AI this, right? Because
No, it's all Whitney.
Okay, thank God. Yeah, it's going to be really important later on, guys.
Yeah.
It's going to be a lot
it's on
of people
video.
are going to be really mad.
Yeah.
See, this is why we can't do video. We're fucked. Okay, so but a red flag is if Anthony was falling in love too fast, too hard, too fast.
Yeah, or
I
like
would also argue if he's vulnerable to manipulation. If I'm hearing his early relationship debuts and I don't like the way other people are taking advantage or gaining too much access or control and he's bad with boundaries, I want us to talk about it. That might not be cut off everybody and discontinue, but that would be a yellow light, proceed with caution. I want us to just be more mindful about this.
set a dating budget.
Oh, there you go.
Oh, smart.
Yeah,
Yeah.
because I got burnt.
Okay.
I learned the hard
Okay.
way.
Yeah.
I was spending a lot of money
Yikes.
going out to nice restaurants.
Yeah.
Oh, you
going
were
out
popular.
to shows.
Yeah.
Oh yeah. No, I was
That's how to
real.
get. You want to talk about how to get popular on those apps? I bet you get real popular.
Yeah, you're buying everybody
I-
tonight.
Did any of the apps do like a
I was a
review type
sucker.
thing?
That'd be
boy.
funny. Yeah.
Oh,
Like
that'd
this
be
guy
hilarious.
took me to like great dinner, great show. Definitely, if this guy
I mean-
matches with you, definitely go with this guy.
We
Yeah.
made the hobo reference earlier, but this would be like a really good hobo thing. You know, like
Oh,
because
yeah,
the
yeah.
hobos would draw stuff in the
Oh,
dirt.
that's right. The little
Like,
patches.
This
yeah.
house is safe. Like
guy.
free meal
Right,
here.
right.
Yeah.
Yeah.
This
Yeah.
is a free meal.
This
guy
guy
will
won't
take
stick
care
the
of you.
dogs on you.
Yeah. Raise your voice. He scares easy. Yeah, exactly.
This is a $300 meal. Right.
So
here.
Yeah.
set your budget early. And if you find yourself, but that's another, I think, again, bad boundaries. Like if he's throwing money at all these things because he doesn't know the social cues or like how to balance out his worth versus like just throwing money to win people. I might not tell him stop dating entirely, but I might say, hey, on the racetrack here, pull over for a pit stop.
Yeah.
We need to gas you up. We need to do some work on this. So there's definitely some conditions that I think we all agree. If we saw, we would be like less enthusiastic about just keep
Right.
going. Like
Yeah.
we would have some concern.
There's something we talked about on Ice Cream Social a long time ago for like first dates, especially.
Okay.
And we talked a lot about, I think it was Matt's idea, or an old thing that he had been kind of living with for a long time, which was early dating, first dating especially, do the stuff that you want to do.
Yep.
Okay.
And like, there's somebody else with you, and that's great. But if they're lame, it doesn't matter because you're doing what you want to do.
Yep.
And like you're taking a friend along with you, basically.
Yep. I want to go see this band.
Yeah.
You want to come with me?
Let's go.
Yes. I totally agree.
Like,
yeah.
do things that you enjoy and have someone with you and see if you enjoy doing the things that you enjoy with this person.
Yeah.
And like, just start there.
Yeah.
Yeah.
It could be real simple.
Yeah.
It could be as simple as you want it to be.
Yeah, I like that. I definitely think that I definitely don't want to paint this as there's no possible downside because I feel like when you're coming out of a long-term relationship, I mean, but I guess
there's
Anthony-
crabs.
There's that.
You will get crabs.
Yeah. Did you know crabs are the kind of pubic lice? They're an endangered species now.
That's why I'm doing my part.
You know what? Play the music.
That's
It's
why-
time. It's time for.
Your father's dick has been
Nope,
in
not
me.
that one. That's not the right one. That's not related to this issue at all. Hey, everybody. Nope, that's not it.
Gather
That's
round, kids.
Also, no, this is
It's
definitely
now
not
time
it. This is
for
nope.
Dr.
I do not have a
Jim
tale.
Job and
Nothing.
the latest
Nope.
tale
Nope.
of
That's not a thing.
woe.
Nope. Nope. Hey, ladies, it's me, Jim. That's not true. I don't have a tale of woe in any way related.
She is a hot, supple
Nope,
19-year-old.
that's also irrelevant to the story. Oh, look, I was going to raise money, okay? I was going to do a Save the Whales bit, but you fucked it up. You
Save
fucked
the
it up
crabs?
real good. Yeah, for $1 a day, you could sponsor crabs. You could help.
Nick won't even use the shampoo.
The arms of...
No.
Yeah, the little fork thing. Anyway, Anthony, love that you have been supporting of our
pincered
show.
arms of an angel.
Angel, fly away. Proud of you, man, that you're getting back out there into the game. And look, at the end of the day, you describe yourself as, fully recovered, that it was 8 years. It felt like a roommate thing. And sometimes that's the deal. And so people will be surprised, like, geez, it's only been this many weeks and you're back in the game. And a lot of times people will be like, honestly, I've been very detached from my partner for a very long time. We were going through the motions. I am ready to meet somebody and feel love again. And like, I don't think that's wrong. But I don't know, like I can see the wisdom of getting some at-bats and having practice, learning the market, learning your worth. I think that matters. I think re-honing those social skills, as Nick said, I think that's really important. I can also just see it as a proceed with caution kind of equation where if you're not, currently talking to somebody about all the experiences you had, you've got to be mindful because sometimes we've developed some bad relationship habits from a toxic marriage or toxic relationship. We need to do some self-work or we're going to carry those into the next thing. And I just want that to be something you're being mindful about.
Oh, I just remembered a business idea that Peter and I came up with.
Okay.
Wingman.com.
Oh, okay. Yeah. So this is, you go out. How does this helpful? What is this guy doing?
Because if you're dating and like you don't have a wingman,
You
you go on wingman.com and you can find another.
And you definitely
another
won't find
guy.
a serial killer.
Yeah. How is the wingman helping you in this scenario?
Dating.
You go on a date and you bring a friend?
No, I'm not talking about online dating.
Oh.
I'm talking about like going to a bar.
Oh,
Like,
you just have
hey,
a buddy.
I want to go to the bar. I don't have, like, all of my friends are married.
Married,
They're all
okay.
married friends. I don't have a wingman.
Oh.
Wingman.com.
I'm sure that exists. There's
Probably.
no way. It's called Craigslist.
Yeah. No, that's where you have the murderers.
Yeah, you will get
This
murdered
was-
if you do that on Craigslist.
no.
All right. Yeah.
Ours was
Results may vary.
Ours was vetted.
Okay. Yeah. Well, look.
There's a whole licensing procedure.
First off, there is a Patreon level where we will wingman for you in Las Vegas.
Oh, I would
All
do
right?
that.
Yeah, there's a Patreon level. We don't do it for free.
No,
okay?
no. We don't do
You're also
anything for
paying for
free.
the drinks. Okay, but yeah, we would absolutely. Also, if you want all four of us to wingman for you, we'll do it. You're probably not going to date.
We
I,
we don't guarantee
all.
results.
oh no, I guarantee results.
Yeah.
Not good ones.
Yeah. But you pay in full and you pay up front. All right, that's
There
the
will
deal.
be fucking results.
We do not
And
work
those
on.
results won't be fucking.
That's right. We do not work on commission. It is a flat rate. It is up front, and you pay for your own airfare.
Yeah.
That is what we offer. That is the new Patreon package, the Wingman package.
Most likely, the four of us would get bored and start playing darts or pool or something, and we're going to be really shitty.
Also,
at it.
we
But yeah.
exclusively only Wingman for you at bowling alleys.
Yeah.
We're just going through a phase.
There
we
is
wanna
no
play.
way that our boredom would be the reson that we were bad wingmen.
We just start walking
We would
around
just
asking
be
people,
bad at
"What do you think
it.
of my friend Larry here?
Yeah.
What are you doing tonight?"
You interested in fucking my buddy Larry?
Yeah. We guarantee the best in
Yeah.
the bowling alley.
Oh yeah. And
Whatever
we'll throw
bowling
the
alley
game.
we're at.
We'll throw
Yeah.
the game, make you look real good. It's like, oh my god, look at this guy. He's destroying his idiot friends. Like, yeah, no, you should see his dick. Like I'll bet you we could play that up.
Yeah.
It'll work.
Check out his dick.
Patreon.com/therapy. We will help you get laid.
Check his
Dick. We're going to take a quick break, and when
Speaking
we
of
come
crabs.
back, we are talking about fearing standing up to my wife, specifically my wife. You're listening to Pod.
She's
Therapy.
very big.
She's very huge.
Today's episode is brought to you by Robert Brownie, Jr. Mintz, Kayla Lansbury, Kevin Chamberlain, Ben Stanley, Adam Hathaway, Dan Martin, Lib, Heyo, Andrew Langmead, Chad Mag, and Inka LaPrince. And if you would like to sponsor the show, become a therapy producer at patreon.com/therapy.
All right. Jacob's up by 1 point.
Okay.
Time for me to stage an epic comeback.
I'm recycling trivia that we haven't gotten to yet.
Yes.
Back to Florida Man.
Oh, yes.
Here we go, Jim. Florida man broke into a Bass Pro Shop. What did he? Nope. No, we already did that one. I remember that one.
A bass.
I don't remember it, so good.
I think he stole a fish.
What did he do?
I need options. Now I will remember it.
I think I already ruined it.
Maybe, actually, I think I know this because I read through it. Took selfies inside the fish tank. Tried to steal fishing lures by swallowing them. Released pet goldfish into the display pond.
Oh, wow.
Oh,
or
that's
hid
good.
in a shark exhibit.
They're all so good.
They have
I
a
don't think-
shark exhibit at Bass Pro Shop?
In Florida?
I'm not saying they don't. I'm
Yeah.
just shocked by it.
I'm going to go with the fishing lures. I'll bet he swallowed fishing lures thinking I'll keep them and I'll pull them out later.
Oh, God.
I'll bet that's what happened.
He keistered some fishing lures.
He deep-throated them, bud. There's a difference.
You
Gag
call
'em
it what
up.
you want to.
He's going to baby bird those up later on.
No. He
goes
drove
to
into the aquarium and swam laps.
All right.
Wait a minute,
Oh.
that wasn't even an option.
That was not. Did he take selfies while doing it?
We'll collect my point. Thank you. Since the game was
No,
rigged.
no points.
All right.
Jacob, what unusual item was a Florida man wearing when arrested for shoplifting?
It's an
Was
Egyptian
it?
Anka.
A full-body Pikachu suit, nothing but socks,
Yes.
a Batman cape,
Oh, God.
a wedding dress.
All of this.
I thought you said it was something unusual.
Aha.
You're right.
Sounds like Friday night
A
at the Smith
Pikachu
house.
wedding dress.
Yeah.
I mean, something. Come on.
Go with that.
Throw me something here. I don't know. They all just seem so tame for what I was prepared for. I was honestly prepared for like 8 live raccoons.
Yeah. Exactly.
Just wearing 8 live raccoons.
Right. Yeah. Wearing his mother as a hat.
Right. I'll say Pikachu.
Yeah, that feels right.
It's a wedding dress.
No, that was my number 2.
Come on.
I'm just not the hopeless romantic I was when I was
Step
younger.
up your game, Florida man. All right. Jacob remains in the lead because I was screwed.
And Florida let us down.
Yeah, that's really
That's for sure.
You know
Let
what?
down by Florida.
1 point from Florida.
Yeah, thank you.
You know what?
It's a long time coming, Florida.
Yeah, and
you
you're
know what
lucky.
you did.
You're lucky it's only 1. All right. Fear of standing up to my wife.
Come on.
Oh, that's a throwback.
Get your shit together.
Hey, folks. First, I love my wife more than anything. Without her, I can't imagine how I'd go on. The challenge is that we're both anxious and depressed people working high-pressure corporate jobs, and I can see the toll it takes on both of us. The issue that most affects our marriage is what I see as her low threshold for overwhelm. I feel like she has a hard time dealing with adult issues, like health insurance, estate planning, or taxes, whereas I generally feel able to handle those things, even when there are setbacks or mistakes. When something goes wrong, though, she often gets completely derailed with frustration, whereas I try to learn from the mistake and try to not get bent out of shape about it. Today's incident involved doing our taxes together. We hit a roadblock and we were both exhausted when she entered an anger spiral. She accused me of not having done my due diligence and that I needed to step up and do more of the legwork. From my perspective, I felt like I had, which felt alienating. During this and any other anger spiral of hers, I tend to shut down and hide in response. I grew up in an emotionally abusive household, so my mind immediately jumps to, the marriage is ending, she's going to kick me out, I need to get somewhere safe. The only way I feel safe in those moments is to remove myself and close off in another room, maybe even cry a little until the fear passes. I know she loves me, but when my lizard brain goes into full terror mode, it's incredibly hard to talk myself out of it. I've told her that anger scares me, what it does to me physically, and that I want her to be able to feel whatever she feels, but she hears that as me trying to invalidate her emotions. The last thing I want to do is make her more angry, so I normally back off at that point at my own expense. To her credit, once things calm down, she usually apologizes for being grumpy, but I wish she would take more ownership of the anger itself. Is this a me problem, a her problem, an us problem? And what can I do to help when she's spiraling while also keeping myself from going into full fight or flight? Love, Anonymous.
Yeah, I'm your wife.
There you go. Yeah, you are.
Yeah.
That's why you're wearing that wedding dress in that last question.
I get overwhelmed
Okay.
with stuff.
Mm-hmm.
Especially, oh my God, and this will be a shock to no one in this room. Tech issues.
Does that bother you?
Computer
you don't
issues.
like a lot of tech? Guy
No,
who,
what?
Whose favorite hobby is to hit a ball with a stick?
yeah. Notoriously, you are bad at tech. Until you're not, which is weird about it. Like, you don't know jack about anything, and then all of a sudden you'll become like a Photoshop master. So It is kind of interesting how this unfolds.
Yeah, no, I get super frustrated very quickly with anything computer related.
Yeah.
I get very frustrated with it. And yeah, so my threshold with that is very low. But other things, yeah, I don't know. For some reason, like there are some things where it's like, okay, that didn't work. And while I still get frustrated, I'm even more motivated to figure it out.
Okay.
Computer issues, no.
Okay.
Like when I get frustrated, I'm like, fuck this.
Yeah.
Fuck everyone who designed it.
Yeah.
And I'm not going to do it.
Computer issues notwithstanding.
Computer issues notwithstanding, yeah. But like household stuff, like, for example, hanging that storage thing from my garage ceiling.
Oh, yeah.
Took me a fucking month to do.
Yeah.
But like
The first one.
Yeah, the first one. Second one took 2 hours.
There it is.
But I was fucking determined.
Right.
Like every night. And to the point where like, I think there was even a little trauma with Laura.
Oh.
Because she's like, can you not work on that tonight? She's just like, can you give me a break? Because it's really loud out there.
Yeah.
All the
but no.
cursing.
Yeah. Oh,
Everybody
yeah.
has their kryptonite. So for you, the overwhelm shows up with tech. For me, it's when there's too much complexity in a decision. So like, I'll just kind of be like, okay, we're going to do this. And like dinner, God, every weekend is a pain in the ass. Because my kids are old enough now that they have fully formed opinions about where they want to go to dinner. So when the four of us are like, yeah, exactly.
Does it fucking matter?
Jesus. So like when all four of us are like talking about, okay, it's Saturday night, what does everybody want? It is mayhem. Like it's, okay, I want to go out. Well, I don't want to go out. I want to stay in. Well, I want pizza. I don't want pizza again. I want Chinese. Well, I don't want Chinese. I want Mediterranean. Well, I don't want Mediterranean. Back and forth. It's this nonstop thing. The two kids have their opinions. We two adults have ours. And usually the two parents are much more like less opinionated because we just want to get it done. But like I will get overwhelmed if there's too many like ideas on the table and too much complexity. Like I wanted this weekend to go to McMullen's.
Okay.
Because it's St. Patty's weekend.
Oh, right. Sure.
And my family's never been there. And I go for Scoop Fest all the time. And it's one of the best kept secrets in Vegas.
Awesome.
And I'm like, it's St. Patty's weekend. Nobody can argue with me on this.
Did
Let's
you
go.
tell your kids they got Guinness?
Right? That's what I said. Hey, they got good Jameson there. You're going to love it.
Yeah, they got Jameson options.
I was pitching the Irish nachos like crazy.
Yep.
And I won this argument. Like I got my wife on board. My daughter was like, let's go. My son was like, man, I don't like to try new things. I want to go to the familiar. Let's do something. I'm just not in the mood to try something new this weekend.
Son.
You know, he's very habituated when it comes to his food. He's just like, nah, I just want to go to my favorite pizza place. Let's
Wait,
do
you didn't
that.
like nachos?
That's what I said. I said, dude, I will vouch for this place. You're going to like it. I know
It's
what
nachos.
you like. It's nachos. You
How
can't-
bad can they be?
It's easy. But yeah. So when that happens and I get overwhelmed, I just shut down. I get really angry and I'm like, that's it. I'm going in the car. Everybody has 30 seconds to get in this car and I'm taking you to this generic place. I don't care anymore. And I just get really like fitty about it and just like upset and just stomp off. And like,
Burger King again.
Fuck everybody. We're going to Burger King. Yeah. I get so mad. So like that's my like Achilles heel. Like tech stuff, I do okay with it. Yeah, but if it's too much complexity in a decision-making process and it's slowing down the decision-making, so we're just deliberating endlessly, I get sick of it and I just don't care anymore. Like just nuke the whole plan, do the simplest possible thing, and I'm done. What is your kryptonite? What overwhelms you, Jacob?
Oh, I don't know.
Whitney.
Fucking Whitney.
Oh, yeah.
No, I don't know. Because, like, yeah, complicated stuff. I'm really good at breaking down complicated stuff.
Okay.
I'm good at breaking down complicated stuff into reasonable portions and like this begets this and this begets this.
That's true. Yeah, which is good in your profession.
Yeah,
it's
yeah.
very good that you don't mind troubleshooting and finding.
Well, I mean, I
the
think
thing.
it might be inherently part of my personality, but I think it's also a learned thing in what I do.
Yeah.
Like
tech is an iterative process. You don't mind iterating through.
We call it signal flow.
Okay.
Like you figure out what's going on in the signal flow. Like that's everything that's happening to it.
Okay.
You find the problem that's in the signal flow, and like 3 different things ahead of it can be causing the problem down the stream.
Oh.
But like that's what you have to figure out.
Actually, that's also my kryptonite. I can't do that shit. That's just too much. Like I would just throw the whole thing aside and be like, "Fuck this IKEA shelf. I can't fix it."
Well, it stops being that option when it's your whole living.
That's fair.
Yeah. No, I don't know. I definitely like.
What do you have low patience for?
Unreasonable. This is a weird show to say this on. Unreasonable emotions.
Okay. Go on.
Yeah.
How does that make you feel?
No, just like the pure, and it's not flashes of it.
Okay.
Because I'm as guilty as anyone for, like, oh, this is a something happens, call it whatever. Not even an intrusive thought. That's the wrong thing. But like, I'm having a bad day. I'm having a bad moment. Whatever.
We're human beings,
and it flashes up. That's not what I'm talking about.
Okay.
I'm talking about like living your entire life on emotional responses and not really thinking things through.
Okay. Yeah, justifying their way of living through this like emotional lens that doesn't really match reality at all.
Yeah. I have a really hard time interacting with that.
Okay. Yeah.
Like just tell me what's happening,
Right.
and like whatever you tell me is happening, I can get behind that.
Right.
But you're telling me things are happening, and I'm just looking at it going like that's not happening, and I don't know what to do with that.
Okay. All right. So we all have our things that get us overwhelmed. We turn into the wife in this scenario. In the writer's scenario here, they're talking about how there's like a trauma response. Anonymous says, I grew up in a family that had a lot of violence that was really scary. And so when my spouse gets all elevated and call it grumpy, call it angry, I go hide and I shut down.
Right.
I need to hide away. And that sucks because it feels like they know this about me. They don't seem to be able to stop themselves from doing it, which might imply it's a her problem. But then clearly my reaction is very skittish. It's wrong sized. That's a me problem. But then it's also this ecosystem.
It's
problem.
a both problem.
It's a both.
Yeah.
Problem.
Yeah, because I've had to have this conversation.
You had no idea we were going to land on both, did you?
Yeah. Go to couples therapy and drink.
No, but you need to have this conversation when you're both calm.
Yeah.
And then kind of strategize. How do we move forward in the future?
Right.
Like, when I'm feeling this way, here's what I need from you.
Uh-huh.
And when you're feeling this way, what do you need from me?
Right.
Because like we've had to have this conversation between Laura and I. I don't know if she wants me to tell you this on the show.
Do
or
it
not,
anyway.
But
Laura and I have had this conversation as well.
She told me it was
I
okay.
know.
Yeah.
Okay, good.
You know what? Actually, I
Good.
just got a text. Yeah, she said go ahead. Okay, no problem.
But like,
I'm FaceTiming her right now.
Yeah, she's actually live. She's in the Twitch. She said thumbs up emoji. Go.
yeah. I just thought about that. She would watch the Twitch.
Oh, that's the worst. That is. Are you going to be okay?
I'm fine with it. Yeah.
Wait, I am upset by your lack of like bother.
Doesn't
Anyway,
matter.
Go on.
Here's the thing. I've had to explain this to her too, because she's kind of like the writer, where like when I get frustrated and angry about something,
Yeah.
I have to be able to explain to her like, this isn't about you.
Okay.
We're cool.
Yeah. But I'm emoting.
Right now, I need some space.
Okay.
Because
All right.
like that's where we are different.
I see.
Where when I get frustrated or I get angry, I need space.
Yeah.
I don't want somebody to come in and try to fix it. I don't want a hug. I don't want somebody to,
I don't want to talk about it.
Yeah. I just give me space. Let me work through this on my own.
Okay.
Then I'll calm down and then we can process.
Okay.
Right. But that's what I need.
Yeah.
Whereas her on the other end, when she gets really frustrated, she wants somebody to come in,
Right.
give the hug, be
Yeah.
supportive, do all of these
Right.
things.
Whereas isolating her might be exactly the
Yeah.
wrong thing to do.
Yeah.
Yeah.
So, and that's where we've kind
Yeah.
of butted heads, because when she's frustrated, I do what I would want,
Okay.
Okay.
which is
Give you
"Hey,
space.
I'm getting the fuck out of here.
Yeah, sorry. And she's like,
You
how
know?
are you abandoning
Yeah.
me right now?
Right.
You're like, that was a gift. You
Yeah.
are welcome.
Yeah. And when I get frustrated, she does what she would want.
She smothers
And,
you.
yeah.
She's
and
like,
then
I got
with the
you,
pillow.
boo.
Yes.
And then you're like, get away
Literally.
from me.
Yeah. She puts a plastic bag over his head.
This is what you want. I know this is what you want because it's what I would want.
Yeah.
Yeah, this is a really good point that like, yeah, an ecosystem reality can emerge as we're seeing here with the writer where, yeah, one person, they get fired up about it and then the other person wilts and runs away. And then that probably provokes the first person and round the spaceship goes. I think, writer, one note that I would give, I mean, I do agree with Nick. I do think it's an ecosystem thing. I think it's something that ideally I would have you in couples therapy talking about your anger pattern, your communication skills. And honestly, a great reboot setting is couples therapy where they're going to work on things like I feel statements and how to do reflective listening and how to like, respond to getting your wife to share why she is angry and what emotion she is feeling instead of just expressing them. Like sometimes talking about the emotion blunts the force of having to live through it. And then it gives you a way to respond to that starts with affirmation and validation and then also offers a corrective if you need to. So that's, one of the things that we talk about in couples therapy a lot is the 3 A's of assertive communication, which is when the person comes at you angry, even if they don't use their I feel statements, even if they have really bad emotional vocabulary and they're just upset at you, for you to start with those 3 A's, which first A is alignment, which is to say, or it is acknowledgement, is to start with acknowledgement and say, hey, it seems like you're really frustrated with me right now. It seems like this whole situation is bothering you. I definitely can sense that you are put off by this and you are upset. So it's like describing the emotions to the person to make sure you're getting them right and that you're not misreading them. And then the second one is alignment, which is to agree with them to some extent, to validate them and say, and I get it. If I were in your shoes, you've asked me to, have the dishes done by the time you get home. So many times you've come home yet again, they're not done. And if I were in your shoes and I felt like this is the 10th time I brought this up, I'm tired of hearing this request come out of my mouth. I'm feeling ignored. I'm feeling minimized. I'm feeling frustrated. I'm feeling disrespected. I get how you feel. And then the third A is assert. And that's to offer. But the truth is, I still agree with you that this is a chore that I should be doing. I agree with you that it ought to be done before you get home. I did not ignore you on this. I had to take a work call, and that has to always trump this directive every time it comes through. It could not be avoided, but I meant no disrespect. So like those 3 A's are a formula that we use in couples therapy. It's a formula that we use in mental health treatment, especially in inpatient settings, to address somebody who's escalated and elevated, validating their perspective, not disrespecting, not dismissing, not running away, engaging with them, but ultimately helping let some air out of the balloon as well and try to spin it in to a meaningful conversation. But this will not work, writer, if you've got such a huge trauma dent from your past that you just cannot help but run away. If you become emotionally overwhelmed, the trauma triggers you, you're not going to be able to access a formula like this and use rational thinking or some kind of like intentional pattern. In that scenario, you probably, the only thing you can do is retreat. And so I don't necessarily feel like that's a problem that needs to be fixed, but I would argue that this pattern, if it's gotten this bad, either that does need to be brought to couples therapy and let that person assess and make individual recommendations, or I'd probably encourage you to go to individual therapy and have a real conversation about your own trauma history and see if there's something to unpack there. Because some of your reactions may just be this call and response thing that you're irrationally doing. And if that's not helping your marriage, if that's, elevating your partner because they don't feel heard or they feel like you skitter away, that's something I'd want you to work on. I also want the wife to work on, anger as well, but we only have you in the scenario unless she's willing to go to couples therapy.
Mm-hmm. Yeah. And Whitney would probably tell
say
you
something
to
really
sleep
sexist.
with as many women
I think
as
that's
possible.
what she would say. That's usually
she's a one
Pew
trick pony.
pew.
Pew pew.
Yep, that's what she means by pew pew.
That's exactly what
Stank
it means.
on the hang low. Pew pew.
We're going to take a quick break, and when we come back, we are wrapping up the show and thanking our Patreons. You are listening to Pod Therapy.
Today's episode is brought to you by Robert Browning Jr. Mintz, Kayla Lansbury, Kevin Chamberlain, Ben Stanley, Adam Hathaway, Dan Martin, Liv, Hey Yo, Andrew Langmead, Chad Mag, and Inka LaPrince. And if you'd like to sponsor the show, become a therapy producer at patreon.com/therapy.
So as we wrap up the show, I want to remind you can go to patreon.com/therapy. You can get our extended show ad-free a day early, as well as enjoy our live chat Discord community and our spontaneous deep dives, interviews, skill shares, research roundups, and rants. We have a new person to welcome to the Theraparty, and at the first episode of every month, we like to thank all of our Therapods on up. We are a little late because life happens. But who is new to the Theraparty here, Nick?
Joining at the Therapod level, we got Jeff Darnell. Welcome.
Welcome, Jeff Darnell. And thank you to Therapods, University Jeff, Robert Paulson, Richard Bruins, Linda Brandmeier, Scoopstronaut, Joseph Pengrazio, Corey Owens, Christine Phillips, Gavin Bristow, Carrie Terhart, Kiwi Fruit Scoop, Take It EV Podcast, Greg Little, Jim Hunter, Scoopatron, Todd Canfield, David Sorensen, Felicia Butler, Shayla Bullock, Lauren Izzo, Lee Popsicle, Katie Chiwakowski, Adam Petanuzzo, Matt Slenegren, Scoopator Ascending, That Josh Guy, Mama Ninja Scoop, James Dawson, Grumpy Lakemead Park Ranger, What Weekend, Sam Buck, Karen McCulloch, Julius Capel, Lila, Kelly Gagner, Nippy, Brian Emra, Matthew Johnson, Alec Lancaster, J.D. Congan, Matthias Vandebrand, A Literal Pickle, Chemist, Ken Tinsley, Finley, Smells Funny, Matthew Cubic, Chad the Safety Lab, Walker Fluke, Joel McMillan, Almost Doctor, Nurse Joey, Duffy the AMFT Therapist Bear, Philip Guyton, Tim Mystery, Kristen Robbins, Freya Lawson, Kierka Grimm, Trisha Ortiz, Drew Helligy, Melissa L. Geisler, DJ Seward, Mississippi Hippie, Scott A., Patty Glad, Fifi, Heather W., Kyle, Trontastic, Anthony Camarada, David Williams, nailed it, Kate Police, Kerna Pillar, Buddy Dobbins, Eric Dyer, Glitch Scoop, Aletta Balaiz, Nathan Mookie, Adam Balaz, Bug Nuts, Stephen Landon, Persephone Hazard, Carmen Perry, John Finlayson, Kenneth Wong, Robert Cole, KJ, Mr. Poth, K. Pizzle Dizzle, Temporary Reality Shop, Jameeby, Jacob Hunt, Syncytium, Ray J. Shark, Silka Daniels, Recreated, What Does Scoop Mean? Alex Jardine, Jacob Billingsley, Dylan Colopy, Chris Courtney, Ben Sherman, Adam Goff, Wolfie05, K Trauma, Sherry Hare, Linus Hakkasan, Kevin Tribe, Cedar Hayden, LC, Chris, Grace, Terrible Tay, Itty Bitty Chicken Farmer, Sam, John Cavaradas, K Matthews, Zachary W, Ashling, nailed it, Chill Food, Salmon Scoop, Winter Scoop, Foxy Sally, Hunter McRae, Zelda Ray, Skywalker, Cloudy Pies, Hannah Emma Maya, nailed it, Joshua Schultz, Andreas, Matthew Connor, Neck Pubes, Almonda Nora, Charm City Therapist, Emily Cope, Garrett Godfrey, Jariva, Nate Walk, Scoop, Bucky, Yep. Squabby, the Listician, the Whittle Shitty Titty Kitty, Renee OK. That's a good one. Kyle Sharton, Matt, Sunrise, Cod, Bob, Peas and Clams, Tom Power, Player Number 1, Rain, Claudia Duhan, Joseph Wagner, and welcoming Jeff Darnell.
That list is getting long.
That's what she said.
Thank you, Pterodactyls. Ice Blue, Scoop Brady, Brian Lehman, Andrea Anderson, Frozen Cusser, Scoop Lindsay, Lori Eltsroth, Polygon, Scoopy, Just Sai, Sean again, Okie, Scoop, Dank, Butta, Brooks Lyle, Adam Ribchick, Lovely Spark, O.E. Time.
Nailed it.
Jim and Manu, not that Jim, but that Manu. The Offices of Counselor and Counselor, a Crusty Croissant, Mike Lush, Technical Scoop Port, Momi Damati, Dale the King, Casey Minter,
nice,
Milk Boy, and Rebecca Boonstra.
And of course, we want to thank the benevolent, revered, generous, and flagrantly pro-therapy diehard who loves you all so much they give till it hurts, our therapy partner Pickett. And we want to thank our bosses, the mysterious and shrouded Illuminati members of the fan club, the therapy producers. Thank you, Jake Schneider, Myra, Robert Brownie Jr., Mint, Smitty Scoop, Richard fucking Macy, Judy Schneider, Malia, Leon Kassab, Carolyn Albert, Kevin Chamberlain, Tess Miller, Dan Martin, Sammy Scoop, Slurpy Kaye, Motherfucker, Ben Stanley, Slap in Your Face, Sarah Smith, Adam Hathaway, Byler T, Mike Helm, Oscar Swanrose, Paris, Sunny Boy, Darren Cunningham, Lib, Sandra McWaffle, Team Monaco, Thunder Cougar, Falcon Scoop, Heyo, Hannah Marie, Andrew Langmead, Emma Tonka, and Pony Soprano, Alina, Brady Malachek, Chick Felicio, Gabriel Adame, Sean Sutherland, Max the Ginger Scoop, Chad Mag, Adam Warren, Inkla Prince, Sam Cohn, Be Gay, Do Crimes, Ellie O'Dare, Not Kira Knightley, and Amy Aardvark.
If you would like to hear this episode uncut and unedited,
And why wouldn't you?
Oh,
and
Whitney.
enjoy our spontaneous side projects, go to patreon.com/therapy, and thank you for supporting mental health.
That's all the time we got for this week's session. Want to thank our landlords, SJ and the Ruckus Studios, and thanks to those of you who contributed to our show today. We really appreciate it. But remember, Pod Therapy isn't something to keep all to yourself. Share the episode with the world. Tag us on the socials when you do. It's at PodTherapyGuys on Instagram, Threads, and Twitter. It's /PodTherapy on Facebook. And don't forget about all the extra goodies at patreon.com/therapy.
If you want to submit a question to the show, you can ask anonymously at podtherapy.net, email us at podtherapyguys@gmail.com, or click the link in the episode description to be taken to our anonymous Google form. I'm Nick.
I'm Whitney.
I'm Jim.
Thanks, and we'll see you for your appointment next week.
Chicka.
And Whitney, you were a lot tonight.
God damn.
I sure was.
I hate everybody. Weird. Bye.
Bye.
Bye.